Hello there, I'm Dr. Phil Hammond. Welcome to embarrassingproblems.com and the penis part 2. In the penis part 1, my first film, I was talking about circumcision, problems with the foreskin and infections around the glands of the penis. I probably should have mentioned that if you do decide you need to have a circumcision, make sure you go to someone, as with all surgery, who does lots of them and does them well. Because you don't want anyone chopping off slightly more than you need to, and you want to reduce your risk of getting infections and bleeding afterwards. And generally that happens if you go to someone who does a lot of them. But as I said in my first film, in most cases of a tight foreskin, in time, gentle easing in the bath with just ordinary bath water, no soap or detergent, the foreskin will come back and sort itself out. So let's talk on lumps and bumps on the penis, what's normal, what isn't. Most people around the glands, the bit that looks like Darth Vader's helmet, in a lot of men they'll notice a little row of tiny little pimples. Very regular, almost like pretty maids all in a row. Sometimes they can go down onto the shaft as well, up the edge, in the midline, but often they happen around the edge of the helmet. And a lot of boys and men worry that they've picked up something like genital warts. In fact, these things are perfectly normal. They're called pearly penile papules. And you can tell they're normal because they look small and regular, and they occur usually in beautiful lines. And as I say, they're perfectly normal papules on the penis that help with lubrication. Please don't try and remove them. I've seen some men get very obsessed who try to shave them off with a cheese grater. That can only cause more harm. You should look after your penis and never try to treat your own infections. I've seen men who put shower gel down the hole and pipe cleaners, all sorts of things, because they want to try and do a DIY treatment. That never works out. In men, more than women, you're more likely to know if you've picked up a sexually transmitted infection. Women often don't have any symptoms at all. It seems odd that the commonest symptom of a sexually transmitted infection can be no symptoms at all. And that applies to men as well, but men sometimes do have symptoms. It can be a slight change in sensation when you're peeing. It doesn't have to be you're peeing razor blades. It can just be, oh, that's a little bit uncomfortable, or you can get peeing razor blades. Sometimes you notice that when you ejaculate, it just doesn't feel quite the same. Not quite as pleasurable. There's a slight numbing of the nerves. And sometimes you notice a great big lump of pus dripping out of your penis. Extraordinarily though it may seem, there are some men I would call genitally unaware, who walk around dripping with pus and don't seem to realise there's any problem at all. This can go on for weeks. So always have a look at your penis. If there's something there that's milky and white that isn't cum, it's just appeared for no reason, or if it's particularly yellow or green, you need to get that checked out, and you need to get it checked out urgently. And rather obviously, don't have sex with anyone, even with a condom, if you find you've got some sort of discharge, undiagnosed lump or bump. It's really, really important that you go down to your sexually transmitted infection clinic, GUM clinic, they have different names, sexual health clinic. And the beauty of these clinics is that they're all completely confidential, in the sense that your notes won't be sent to anyone without your permission. So your GP doesn't know about it, your mum doesn't know about it, nobody knows about it. But these infections generally won't go away unless you get them treated, and of course you can pass them on to other people. So those are the common things you notice: a discharge from the end of the penis, a pain passing your urine, or a slightly odd feeling in the penis, or odd feeling when you ejaculate. Of course, you can also get lumps and bumps on the penis. We've talked about the PPPs, the pearly penile papules, which are normal. Genital warts tend to be more roughened and irregular, like warts you get elsewhere on your body, and sometimes they can be almost like little flat warts. Sometimes they can come out on a stalk. Either way, they occur all over at sort of irregular places on the penis, and they look pretty unsightly. And you think, oh my God, what are they? They're generally, again, not going to go away unless you get them treated. Treatment can be a bit fiddly. There's a sort of an antiviral paint. They're caused by HPV viruses. And there's something like antiviral paints you can put on there, or you can have them frozen off. Sometimes you have to have more than one treatment. It is a bit fiddly and it's a bit distressing, but generally they do go away in time. And the other sort that you can get, of course, is herpes. Herpes, when you have it for the first time, can be quite uncomfortable. It's not as bad as you think. It's just a cold sore gone south, a little bit like having chickenpox on your knob, sort of similar viruses. But the first time you get it, it can feel pretty awful. It can be quite painful. And sometimes you'll have an obvious blister to see. Sometimes you might feel generally unwell. The good news with herpes is that if you do get other attacks, they tend to be less severe. And the other good news with herpes is that we have this fantastic medication now, antiviral medication such as acyclovir. And if you take them at a large dose early on, it can rapidly reduce the length of the infection, and it can reduce your risk of getting subsequent infections too. So there's lots of good news, but only if you get help. The common sexually transmitted infections, things like chlamydia, are pretty common. You may just have a little slight discomfort ejaculating or passing urine. Gonorrhea, often you'll get more of a profound discharge. With syphilis, which is making a bit of a comeback, sometimes you get a chancre, a sore on the penis. So it's worth, when you're doing your daily foreskin hygiene, you're washing behind the foreskin, you're removing all the smegma, you're giving it a bit MOT, you're not polishing and buffing it with detergents and nail scissors or anything, you're just, gently washing it in water. If you notice anything that wasn't there yesterday, notice anything you're at all concerned about, come down and get it checked out. There's a certain group of men we call squeezers, who get it into their head that they've definitely got a discharge, and they squeeze the gland and they squeeze the gland and they squeeze the gland and almost give themselves an irritation through too much squeezing. You don't need to do that, you just need to go down and get it checked out. And these days they don't put an umbrella down the end of your penis or any of that nonsense. Generally you pee in a pot. Most sexually transmitted infections can now be diagnosed very cleverly with testing of urine samples. So it's not traumatic, it's all done in confidence. You get sorted, you do some contact tracing, which is really important. A health visitor will come in, or a specialist tracing nurse will come in and talk about people you've had sex with, and we'll trace them all so we can treat them all. Because if you don't, you'll get treatment and then you'll just sort of pass it round again. We tend not to call them sexually transmitted infections anymore, we try to call them sexually shared infections. You share pleasure, occasionally you share bugs, and if you share bugs you share treatment. You all get sorted and you can carry on having fun. But of course all this can be dramatically reduced if you learn how to put a condom on. Not always easy, but worth having a go. Instructions in the packet. You've got to get the rolled edge on the outside so it goes down over the penis. Put it on well before you do any insertion. And at the end, hold on to the base quickly before your penis shrinks down again and withdraw, holding on to it. And if you learn to use a condom every time, then your risk of getting any sort of lump or bump or sore on your penis is dramatically reduced. For more advice on embarrassing problems, go to embarrassingproblems.com, the website. If you want to check me out, I'm drphilhammond.com. In Penis Part 3, we're going to be talking about erection difficulties. Do you have a bend in yours? A lot of people do. See you later.